Well, I played professional hockey for 18 years with the Detroit Red Wings, Toronto Maple Leafs, and then the WHA, and even got to play for Team Canada. And so I'm a very active person. I always try to keep myself in physical conditioning.
Chronic lymphocytic leukemia, or CLL, is a cancer of white blood cells that come from the bone marrow.
I was diagnosed with CLL back in '09, November of '09. I went in for my annual physical, and that's where we found the growth, and they did a biopsy and got the prognosis.
The average age of somebody diagnosed with CLL is about 75 years of age. And in 2010, an estimated 2,200 Canadians were diagnosed with CLL.
When I was diagnosed, I had no clue what CLL was. I had no cancer in my family, and so I was very naive.
Leukemia is also a potentially life-threatening condition for people, and obviously is a very devastating diagnosis to be given.
Well, I knew as they told me there was no cure for it. That wasn't exciting news, but I knew I had some time to look into it and educate myself.
Patients who have CLL go through a process of progressive symptoms.
I think fatigue was one of the things that I had to deal with, but I was approaching 70 at the time, so I didn't really know whether it was just old age or cancer, but I was blaming cancer.
In the beginning, it may just be a rise in white count, and patients may feel very little in the way of symptoms. But when symptoms do start, it diminishes quality of life quite significantly.
Initially, I tried to beat it from the inside out. Really got on strict diet, physical exercise and all that, but it was going to get me, and so we had to look for a treatment.
A first-line therapy is really your first crack at taking on therapy that's designed to get you into remission. 10 years ago, we had limited options, especially for patients that were older and perhaps frailer.
When treating CLL, choice of treatment often depends on the patient's age and general health. Today's frontline treatment landscape for people with advanced or symptomatic CLL is generally made up of traditional chemotherapies and newer chemotherapy options. In 2009, when Paul was diagnosed, he opted not to undergo chemotherapy.
I still have cancer. And so don't give up. That's the thing about it. And obviously, educate yourself. I think there's a lot of hope. I really encourage people, fight like the deuce. Do whatever you can do to stay alive.
Every patient has different needs, and as a physician, having a shelf full of options is remarkable. This really is the future of cancer therapy, and this is what we're seeing in CLL.
We decided that cancer was not going to define me. I decided that if I woke up in the morning, it was going to be a good day. Obviously, I didn't like the fact that I had cancer, and so that's the way I've lived. I've got today. I'm going to live it the best way I can, and cancer is not going to defeat me in enjoying life.
To find out more about how the treatment landscape and outlook for patients with CLL has changed, visit www.healthandfamily.ca/CLL.